Hi, guys. Welcome back for our daily practice questions. It is day 195 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit that subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I offer. Also, you guys, today is the last day for early bird enrollment for my upcoming 5-week intensive review. This is the review course that everyone typically use when they're joining my group cohorts that you have seen a lot of the success reports behind. But the thing about early bird enrollment, you save $100 on the cost of the course. So today's the last day to do that. You have until midnight if you're looking to join at the discounted rate. And then you'll see that we have just a couple of more weeks left of enrollment time, but it will be at the full price. So that link is in the description as well if you're looking to join, but don't say I didn't tell you. All right, y'all. Question number one. A 2-year-old child presents with vomiting and diarrhea for 2 days. He is alert, has mild dehydration, and is tolerating small sips of fluid. What is the most appropriate first line treatment? Is it A, IV fluids and ondansetron in the office? Is it B, oral rehydration therapy and feeding as tolerated? Is it C, prescribed anti-diarrhea medications? Or is it D, start empiric antibiotics? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, what is the most appropriate first line treatment? And I always tell you, if they're asking for a treatment, you got to run it back and see if they provided you with a diagnosis. In this scenario, a diagnosis has not been provided. So, I say at that point, then you need to run it back a step further and look at those assessment findings because we got to know what it is to be able to treat it. So here we have a 2-year-old child that comes in vomiting, diarrhea for 2 days is the chief complaint. The 2-year-old is alert, has mild dehydration, and is tolerating small sips of fluid. So at this time, the best answer and treatment for this child will be B, oral rehydration therapy and feeding as tolerated. Um, with this is gastroenteritis, right? So you want to get the main thing, knowing that they have mild dehydration, is making sure they are hydrated, but also keeping feedings incorporated at a small increments on what this little child can tolerate, right? And think about your Bratz diet, your bananas, your rice, your applesauce, your toast, things that are going to be more easily tolerated, but giving these so now the child is not also depleted and dehydrated severely with these gastroenteritis associated symptoms. All right, question number two. Which of the following findings in a child with gastroenteritis warrants referral to the ED or hospitalization? Is it A, 2 episodes of loose stool in 24 hours? Is it B, capillary refill under 2 seconds? Is it C, sunken fontanelle, lethargy, and persistent vomiting? Or is it D, a fever of 100.4 degrees with mild diarrhea? Take a moment and tell me what you got, y'all. All right. So stem of the question here. STEM is the question. The question is a STEM, and it states, which of the following findings in a child with gastroenteritis warrants referral to the ED or hospitalization, right? And C is your best answer. Those sunken fontanelles, lethargy, and persistent vomiting. This is showing you moderate to severe dehydration with those sunken fontanelles. Lethargy, not good, especially with small children, with any patient, but small children definitely. And then they're still having that persistent vomiting. You're going to want to refer them out because they're going to need that IV hydration source. If they're having this persistent vomiting, and first line therapy for gastroenteritis is that oral rehydration, they're not going to be able to tolerate the amount of hydration that they need compared to the severity of dehydration that they already have, right? So that's the best answer of who to refer out for ED or hospitalization, okay? All right, and lastly, question number 3. A 7-year-old boy presents with involuntary stool leakage and a history of chronic constipation. Abdominal x-ray shows stool burden. What is the best initial treatment and outpatient management? Is it A, to refer to gastroenterology immediately? Is it B, begin short-term fiber supplement only? Is it C, start oral polyethylene glycol for clean out followed by maintenance? Or is it D, prescribe loperamide for stool control? Take a moment and tell me what you got, y'all. All right, stem of the question here. What is the best initial step in outpatient management? So again, this is still a treatment style question. So we need to run it back and see if they have given us a diagnosis, right? And so diagnosis has not been provided. So let's see what assessment findings we have. We have a 7-year-old boy comes in with involuntary stool leakage and a history of chronic constipation. The abdominal x-ray shows stool burden. Y'all, this is classic presentation of encopresis. And remember that with encopresis, they typically have chronic constipation that's leading to like this incontinence. And so with this, C is your best answer because the way that we treat this is typically with laxative or stool softeners like your polyethylene glycol. Think like your Miralax. That's what these things are. So your laxative stool softeners to help do like a clean out and follow with maintenance to prevent the constipation, because remember, we're treating the source. We're preventing the chronic constipation because that is the source of the incontinence. If you can treat and prevent the constipation, then you will in turn prevent them from having this stool leakage and incontinence. Okay, so C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And as I mentioned previously in the video, my website is also linked in the description and it houses everything that I offer. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.